Hello and welcome to 5 Minute Videos. This is a review for the NCE, Dr. Pepe, and today we are going to be covering Domain 3. Category A, adjustment related for physical loss, injury, or medical condition. So these fall under adjustment disorders. So let's review what that looks like for this test. So adjustment disorders are an excessive reaction to stress that involves a negative thought, strong emotions, and change in behavior. So the reaction to a stressful change or event is most intense than would typically be expected. And of course, this causes a lot of problems. There could be issues with functioning, problems at work, school, illnesses, as well as daily self care. Um, for any adjustment disorder, the DSM says that there is some time that clients will become adjusted, and they mention usually it's after a few months. So, what are some of the symptoms? So, some examples of an adjustment. Or issues with adjustment due to physical loss or medical conditions that can include feelings of sadness, hopelessness, not enjoying things that you used to enjoy, crying often, anxiety, worry, irritability, having trouble sleeping, not eating enough or eating too much, difficulty concentrating or performing daily activities, withdrawal from friends and family, not doing important things such as self care or taking care of financial obligations, and then suicide ideation. So, some of the causes relates to changes in genetics or changes with illnesses or accidents, whether it's acute or chronic. And then some of the risk factors could be trauma as a child. It could be marriage or partner issues, relationship problems, major changes in life, having a child, retiring, moving away, relocating, stress in jobs, problems at school, um, trauma, so things like physical assault, um, natural disaster, ongoing stressors could all be things that one should keep in mind. So, again, adjustment disorders, when they relate to physical loss or medical condition, can really be a general term, but it can really have a lot of varying factors. And to me, an adjustment disorder is something that the client is grappling with, but it's not as debilitating or as permanent as maybe a chronic condition. There is no guarantee of prevention for adjustment disorders because, again, a lot of it is unpredictable. We cannot predict acute accident or natural disaster, but we can take just different preventive actions such as wearing a seatbelt or evacuating, things like that. So that is just some information on adjustment related physical loss, injury, or medical condition. And again, just remember when the word adjustment comes in, that means that something occurred that created a condition in which the client is now having to adjust or having to modify their day to day functioning.